to another episode of PHI, Public Health Impact. I'm Cham Dallas.
And I'm Phaedra Corso. And in this, our third season, we are talking for the third time about public health careers. And I'm excited to do this, Cham, because this is what public health is all about. This is why we train people.
That's right, Phaedra. And today we're going to talk with 3 alumni of the University of Georgia College of Public Health about their experiences as students and now as public health professionals.
And we've been in existence as a college for 8 years, and we've really trained a wide range of public health professionals.
Well, public health professionals are in great demand now across the globe, and I'm proud to say that the University of Georgia College of Public Health has produced hundreds of public health professionals.
And so today we'll be talking first about the public health internship process. And that internship is really important because it serves as the gateway for our students to become professionals.
That's right, Phaedra. The college prepares our students academically, which you expect, but where the rubber meets the road is in the public health internship program, which is run by our practice coordinator, Nina Cleveland, who we'll see next.
Well, thank you for joining us today, Nina. I'm so glad you're here. Why don't you tell us a little bit about yourself?
I got to public health in kind of a roundabout way. I started out as a social worker working in alcohol and drug treatment and spent about 15 years doing that. And then I decided to go back to graduate school. I also have a nursing background, so I really wanted to get involved in population health and prevention. I've always been a big believer in prevention. So I was in the first class that the College of Public Health produced in a concentration of health promotion and behavior.
And so when was that? What was the first graduating class?
2006. I graduated in 2006. There was a cohort right behind me in that spring and summer.
And so what did you do when you graduated with your MPH?
I went to District 2 Public Health, and it was a wonderful experience. I ended up, because of Cham's class in disaster management, getting pulled into that direction, which I loved. So I did emergency preparedness there and then went to the CDC.
And what did you do at the CDC?
I was doing emergency preparedness as well.
Okay.
For quarantine and border health services.
Okay, and so you obviously work for the College of Public Health now. What is your position?
My position title is practice coordinator. What I do mainly is, my biggest hat is coordinating the internship process for Masters of Public Health and Doctorate in Public Health, from beginning to end.
And so explain that to me. What does beginning to end mean?
Beginning to end means I start out really with site development. And for instance, if you had a particular site that you wanted to start sending students to for internship, you could email me or pick up at the phone and say, I would really love to send students here. So I would work on my end doing the memorandum of understanding, which we have to have in place, and develop that site. And then from there, I start prepping the students with resume help. And they come to the department and myself for advisement. We let them know what sites are available. We try and match skill sets and interests.
Right. And about how many of these are you running a year?
My biggest semesters are spring and summer, and I'm usually running anywhere from 35 to 40 students.
Wow.
So I have 35 to 40 in prep coming in, and then I have 35 to 40 actually in internship during the semester.
So you have a really good bird's eye view of what the public health career landscape looks like. What kind of opportunities are our students getting?
I see a lot right now in epidemiology, environmental health and safety on the private sector. I also see a lot in health promotion and behavior, health education, program development. I'm seeing a lot in policy and management, especially in hospital settings and quality. There's a big initiative in a lot of the hospitals now, like you're probably aware of in their quality improvement.
Sure.
So
can you give me some examples of maybe some internships that students are currently doing?
I have about 35 in this semester, and they are running the gambit from in a hospital setting, developing quality assurance programs for, I believe one is within a pharmacy. So they are doing analysis and evaluation of that program and developing policies to help it be more efficient and more customer service oriented. We have several placements within the National Center of Environmental Health and ATSDR, where students have a whole gamut of students doing everything from policy to EPI to environmental health and toxicology related internships there. I have a lot of folks at our local nonprofits doing policy related things, doing management related things. We have people placed at nonprofits like Athens Nurses Clinic, Mercy Health Center, American Red Cross is one of our favorite ones, especially for our management folks.
So let me ask you a couple of other questions. What kind, first of all, how much training in the MPH program, for example, does a student need before they go into an internship, and how do you gauge whether they're trained enough, I guess, for the position? I mean, how does that work?
How do I do that matching kind of thing? First of all, one of their requirements is they have to have all of their core courses before they are even considered to go into internship. And at the department level, they also, there's some guidelines about when they feel like they've had the coursework that gives them the skill set to do what they need to do. So what happens first is the student will probably go to their departmental advisor and say, this is what I'm thinking, or they will start talking at the department level. Then they will come to me, and I usually like to do a face-to-face with them and ask them what their interests are, make sure that they are meeting those minimum requirements.
All right, so then once they do their internship, they finish up their coursework and graduate, how frequent is it that students will get placed where they do their internship? I mean, I would imagine the goal is to open them up to a career opportunity eventually.
There are a good number of placements directly out of internship into that agency at some point. And then even more so, the connections and networking they're able to do during that time opens them up for other possibilities even outside that agency. So what we are really trying to get for them is that first foot in the door, so that they can get in the network. That's why I try and match interests. My first question is, when I meet with them, where do you want to end up? Where do you see yourself? And so we try and make that internship so that they can get in that network.
Now, I understand that there's a new initiative in the college to specifically address career development. Can you tell us a little bit about that?
Absolutely. It's something I'm really excited about. We are making a big push to make them workforce ready. So that starts, like I said, with internship advisement, where we start talking about resumes, we start talking about CVs, we start talking about interviewing skills, workplace culture, one-on-one. Then I have started offering a workshop. It's like a half-day, three-quarter-day workshop where they get some hands-on time with preceptors, learning what preceptors are looking for, practicing interviewing skills.
And so preceptors, just for people who might not know, is basically their supervisor, their on-site supervisor?
Yes. Yeah. Internship has either a site supervisor or a preceptor there who does the supervision at the site.
So it sounds like you're really getting them ready to be a professional.
Absolutely. To me, it's very important that you guys work on that academic, make sure that they have the skill sets to do the job that they want to do. I kind of see my job is to prepare them professionally so they will know how to present themselves and how to fit into the workplace culture.
All right, my last question for you, Nina, is what do you see being on the horizon for our students in public health? I mean, what's the next big thing that we should be looking for?
We've got a couple of big things going on right now. One is the Georgia Public Health Training Center funded internships. This is a big initiative to introduce students to rural placements to rural public health. The other big initiative, and you'll probably hear more about from the Center of Global Health, is our push for international internships, which Anjali Mathew coordinates from their end. So it's some really exciting stuff coming up.
Great. Well, thanks so much for being here today.
Thank you for having me.
We're now being joined by Anjali Mathew, another alum of the College of Public Health. Thank you so much for being here today. Why don't you tell us a little bit about yourself?
I started off at UGA as an undergraduate and I majored in international affairs. And then I decided to continue on at UGA with getting my master's in public health with a concentration in health policy and management and global health.
Okay, so let me ask you, before we get to all the important stuff you're doing now, let's talk about your trajectory here. How is it that a student in international affairs then goes into public health? What was your thinking there?
Well, I was thinking that I'm very interested in political systems around the world. I'm also thinking that I'm very interested in population health. I took a year and a half off to figure this all out, but I decided that getting my master's in public health was exactly what I wanted to do. I want to work in international settings. I want to be involved in population health and preventative health.
Okay, and what are you doing for the university now?
Right now I'm the Educational Program Coordinator at the Center for Global Health, in which I primarily coordinate a graduate certificate in global health and soon to be an undergraduate certificate in global health. I also manage and develop study abroad programs and also identify internship sites for our graduate students.
Oh, okay, so we just talked to Nina Cleveland about the internships that she's coordinating. Why don't you tell me a little bit about what you're doing and how it is the same or different than what Nina's doing?
Yeah, Nina and I work very closely together. We work very well together, and we do have similar roles in that we meet with students, we advise them academically, we develop learning objectives with them. I'm sure Nina spoke about that. We also identify internship site placements for our students. How we differ, though, is that Nina deals primarily with domestic internships, those within the United States, whereas I meet with students who wish to go abroad for their internships.
Okay, so that sounds very exciting. I think for most students want to go abroad. So why don't you give us some examples of some internship opportunities that students might have?
So just to give you an idea about the process, usually a student comes into my office and just says they want to go abroad for an internship with no actual country, specific country in mind. So I tell them that the Center for Global Health has established a number of international cooperative agreements with various health organizations in many different countries, including countries like Israel, Peru, and Croatia. And so usually students are enticed by these countries and they want to go somewhere like that where we have established relationships with. However, there is sometimes an instance where a student comes in and wants to go to a country we don't have an established relationship with. For instance, a student may want to go to a country like Cuba. Perhaps they have family there, or they've lived there, or they've done some community work there and they want to give back. And it is my job to coordinate or find the relevant health site there that's willing to take our interns. I find and identify site supervisors. I make sure that the site supervisor understands the student's curriculum, learning objectives, and I also make sure the student has an overall good experience there.
So how do you do it? Do you just cold call these countries and say, hey, I'm from the University of Georgia?
I have done cold calls, and sometimes they're successful, sometimes they're not. I usually work hand in hand with the student because sometimes the student has a connection there. But generally, I've had really great experiences linking with these health sites around the world, and people are excited to get interns, especially our Masters of Public Health interns.
So I want to hear, I need to hear at least one or two examples of what students are doing.
So right now we have a student in Australia, and she's working at the Australian, it's basically a skin cancer clinic, and she's dealing, Australia has a major skin cancer epidemic, and she's looking at research there and doing some data analysis. She's an epidemiology major. We also have had students who've been to low-income countries like Uganda and Kenya, and where they've been evaluating public health programs, specifically a vaccination program. We have a student currently in Croatia, and she's evaluating some public health programs at the community level there. We have sent students to Germany, to St. Lucia, just to name a few, and actually the number of countries we're sending students to is just growing, to be honest.
Yeah, that's great. So I want to come back to you now. So in addition to being the Global Internship Coordinator, what other responsibilities do you have in the center?
So I also coordinate a graduate certificate in global health program that we have. We currently have about 15 students and 15 alumni since its inception in 2010. And so from there, I provide some academic advising for our students, make sure they fulfill their programs of study. It's an 18 credit hour program. I'm also in the works of developing an undergraduate certificate in global health because, as you know, global health is kind of a hot topic these days, and we've seen a lot of interest from throughout the university, including undergraduates interested in global health.
You're doing some amazing things, Anjali. So my last question for you is, where do you see yourself in 5 years? Are we going to be able to keep you here in the College of Public Health, or do you have greater aspirations?
As much as I love doing what I do here, because I get to work with amazing people, I get to connect with people internationally that I would not have the opportunity to meet. You know, I get to hear from them, hear about their experiences in their healthcare system of their home country, and it's great. And so this is a great opportunity for me. But in 5 years, I do hope to be involved in some sort of program coordination for a specific public health program, whether that be at the community level or at the national level. It'd be, either way would be great for me.
Great. Well, thanks so much for being here.
Thank you.
With us now is another College of Public Health alum, Jo Ballard. Thank you so much for joining us today.
Thank you for having me.
Before we talk about your current position, I'd like to know a little bit about how you became interested in public health.
Sure. I was an undergraduate here at the University of Georgia studying psychology, and I heard about the opportunity to volunteer for a secondhand smoke study under Dr. Nair in the Department of Environmental Science. So I thought it was a perfect fit. I wanted to try it out. It seemed interesting, and from there, after the study, he encouraged me to pursue my master's in public health.
Great. So, so what was your concentration area in the MPH?
It was environmental health science.
Okay. And just since we've been talking a lot about internships today, what did you do for an internship?
I interned at Georgia Emergency Management Agency. I also got my certificate in advanced disaster management from the School of Public Health, and made me interested in emergency management.
Oh, that's great.
Yeah.
And why don't you tell us about what you're doing now?
I'm the executive director of the Governor's Office for Children and Families. So we're a small state agency that provides over 200 grants across communities in Georgia, and we have 4 divisions. We have juvenile justice, which focuses on diversion and alternative programs to detention; youth development, which is abstinence education, after-school programming, and domestic minor sex trafficking; family violence, which is sexual assault and domestic violence; and then we also fund the child advocacy centers; and we have a prevention and family support division, which is child abuse and neglect prevention as well as home visitation.
Before I ask you some more specifics about the GOCF, I do want to know, how did you get this position? You graduated in 2010. You're the executive director of a government agency at the state level. That's pretty amazing. So how did you do it?
I am very blessed to be in the position I am, and I'm honored to be able to serve the governor. When I graduated, I had an interest in politics, and at that time there was the gubernatorial campaign going on, and Governor Nathan Deal was at that current time my district's congressman. I'm from Habersham County.
Oh, great.
So I joined his campaign, and from there got to know his politics and really believe in what he's doing, and he's had that faith back in me to entrust me with this agency.
And so how has your Master's of Public Health training prepared you for this position? And maybe tell us how it hasn't prepared you. So I think it's good for us to know, like, what do you learn on the job versus what do you learn in a degree program like an MPH?
Well, this has been a very steep learning curve for me after graduating. So the degree has been wonderful for me, from statistics to health promotion, learning how to engage a community and to get community buy-in. For example, we've created new standards for all the domestic violence shelters. So it was important for us to have that community buy-in. So we've engaged the executive directors of every shelter across the state in helping us create those standards. So if it comes from their peers versus a state agency, they're more likely to adhere to those standards. And then as far as something that I wish I'd had the opportunity to do was, in my position now, I work with people from all different types of backgrounds, different degrees, different professional degrees, and I think if the school could think about a way for us to engage with different, maybe the JD program or the Masters of Public Policy programs, just to understand and work together, because that's something that the workforce teaches you quickly, is how to, what each degree and background brings to the table.
Yeah, you have expertise, but so do the other people, and so you kind of need to know what that level is.
Right.
So why don't you tell us about some new initiatives or some exciting initiatives that you're involved in right now?
Sure. The governor is working on the juvenile code rewrite, so we, of course, administer grants for diversion and alternative programs to detention. So through that juvenile code rewrite, we've been able to work on the public policy, help write the code, and now we're going to have dollars to incentivize local communities. So that's really what we're about. Our agency is to build community capacity. The governor is a huge proponent of local control. So he wants us to assist communities in empowering their families. So that's our main goal. We have several different interesting projects going on. The standards I mentioned for domestic violence, the child advocacy centers, we're coming up with new standards for them. For domestic minor sex trafficking victims, we coordinate the statewide response. And we also are charged with interagency collaboration. So what's called the Georgia Children's Cabinet sits in my agency, and we bring together every other month all the child-serving state agency heads. And it's a 2-hour work session that I lead, and we just go through what gaps are out there, what policies are presenting barriers, how can we cut the red tape to provide better services to the children and families of Georgia.
So it sounds like from what you've told me already that the primary mission is violence prevention. Is that the case?
I would say about half of our dollars are dedicated to violence prevention. We're a total of $32 million agency, and a little over half of that goes to the child advocacy centers, sexual assault centers, domestic violence shelters.
And so you have $32 million in grants that go out to communities. Who can apply for those grants?
Any community can apply. It depends on the funding stream that it comes from, but we list those on our website. And it can be a local nonprofit, to a state agency, to a board of education. Our grants vary.
And so just give me a sense of, at the community level, what does this governor's office mean for public health?
So we really want to build community capacity and help people understand what issues are out there. For example, we're charged with training. So last year they changed the mandated reporter law, and we have a free training that's available online for anybody who qualifies under that law for mandated reporting. And since that law came out, we've trained over 50,000 Georgians.
So I'm actually very interested in the mandated reporting, because I'm working on an IOM report on child maltreatment. And so I just am curious, is your office doing anything to evaluate the impact of your training or the impact of the change in the mandatory reporting law in some way?
We are not. That's something that the Department of Children and Family Services is looking at. So we haven't been working with them on the evaluation piece.
But you raise a good question for me, which is, how do you interact with the other pieces of government at the state level?
At the Children's Cabinet meetings, we collaborate on issues like this. So Department of Children and Family Services, their commissioner, sits at the table with us. So we'll bring up mandated reporting law and talk about what his agency is doing. We try not to overlap, but support each other in that.
So a final question for you is, since you are sitting at a very high level of government here in Georgia, you have the opportunity to see public health in a different lens than many of us do. What opportunities do you see for public health graduates in the state of Georgia, and maybe what's the new thing on the horizon that we should be looking for?
For me, I think that someone who graduates with their degree in public health shouldn't be limited to think that it's just healthcare, or it's so much more than that. From running a local nonprofit to writing policy, of course I'm going to be a proponent of state government. We have the ability to change the climate for Georgia over the next 6 years, and that's a unique opportunity to write protocols, to create standards that are going to impact the state long after us. So I would encourage students to think about where they want to be, what change they want to see, and what they're passionate about, and just pursue that. I didn't want to be limited by environmental health science. I wanted to follow my passions, and I'm grateful for the degree I've received and use it daily.
Well, we're very proud of you, and we wish you the best of luck in your position.
Thank you.
You know, it's spectacular to see the diversity of opportunities open to our students, to our alumni, and to prospective students in the field of public health.
And to hear about the new career development initiatives that are being undertaken here in the College of Public Health.
Yeah, as we saw in the episode today, there are not only opportunities here in the state of Georgia, but throughout the world, and indeed here in the network of public health in this state, in Georgia, it is embedded with University of Georgia alumni now.
So if you'd like to learn more about careers in public health, please visit us at our website, and you can learn about all of the academic programs that we provide in the College of Public Health.
And don't forget to join us in the next episode, which is about emergency preparedness, where we'll take you right to the heart of a disaster exercise in the middle of Atlanta.